Welcome to the Intent Health Vodcast, brought to you by Intent Health, the healthcare public relations agency. We deliver authentic campaigns that change behaviours and improve health. Our founding principle is that diversity in all its forms creates more engaging campaigns. And with that, for this Intent Health Vodcast, I'm your host, Dan White. Excuse the shirt. 1 in 5 people in the UK live with a hidden disability. In fact, it's thought up to 70% of all disabilities are hidden. For individuals with a hidden disability, such as autism, Crohn's disease, epilepsy, insomnia, even depression, and of course, a learning disability. The list is extensive. People with hidden disabilities are often subject to discrimination and misunderstanding. Negotiating life and people with a hidden disability can be tricky at best, but add a pandemic into the mix and the pot is overflowing. Today, here on the podcast, we're here to discuss how we can raise awareness of hidden disabilities, highlight what needs to change, and how we can achieve better understanding from the government and workplace to the individual on the street in our now COVID world. With me is a wonderful Ciara Lawrence. Ciara works at MenCap and she is a fierce campaigner for hidden disabilities. And Ciara and I go back a long way. Ciara, hello, how are you?
I'm fine, thank you, Dan. Thank you for having me on today. I'm very well, thank you.
It's an absolute pleasure. Couldn't think of anyone else to do this. You are brilliant. So, Ciara, can you tell us a little bit about yourself and your career?
So, yes. Hi, my name is Ciara Lawrence. I'm 41 and I have a mild learning disability, and I work for the UK learning disability charity MenCap. I'm currently working as a big plan engagement lead role at MenCap, working on our big plan, which is really exciting. But apart from that, I live in Surrey and I just spend my days trying to make sure the voices of people with a learning disability are heard. So for me, I wasn't diagnosed with my learning disability until the age of 10. So I was diagnosed quite late on in childhood. And the schools that I was at just decided to ignore me totally. They gave me no support. They didn't have resources. They didn't have teacher training then. And I had a really bad time at the schools I was at. And then finally, at the age of 10, here comes the diagnosis. I have a learning disability. Then what's next for me? I'll never survive in a mainstream school ever again, even if I got a bit of support. So I then went to a special needs school, which was a residential boarding school and also a day school for girls with lots of learning disabilities, physical disabilities, autism. So they really catered for a big amount of people with different disabilities. It was a girls' school. It was a really small school when I was there. It was in the early 90s, so a very long time ago. And I left there with 5 GCSEs. And yes, I know there is a big debate about mainstream education versus special needs education. I personally think, my personal view is, it's up to the individual and their family to decide what's best for them. And I do preach inclusion. I think inclusion is best. And I do think children should be educated together. But then if the child needs extra support and the school can't provide that support, then it's up to them to decide actually what is best for their child, because their parents know them inside out. They know what's best for them. They are the, advocates for them when they're children, and it's up to the individual and their parents to decide what's best for them.
That is fantastic. I couldn't put it better myself. See, this is the reason we wanted you as guest, because you're so articulate, you're so clever. You've been through the system. You know how it works. You know the best way it could work for other families, and your knowledge of hidden disabilities is incredible. And awareness of hidden disabilities is often very rarely discussed. Many people still aren't even educated or even aware of hidden disabilities, don't know what to look for. Has this affected you in any way? And how has it affected your life, this so-called ignorance of a hidden disability?
Yes, totally. It's the public. It's public attitudes that don't help. It's the media that don't help. the media write negative stories about people with a learning disability like me, people will read that, people will see that, and they form a negative view of people with a learning disability. However, if the media write more positive stories about the things we achieve and the things we can do, then we can challenge perceptions and challenge stigma. But the media carry on writing negative stories such as benefits, people getting benefits, benefit scroungers, people with a learning disability. Let's feel sorry for them because they get really bad healthcare. Let's feel sorry for them because, they're not heard. Let's feel sorry for them. And that does not help us. It does not help us challenge stigma. It does not help us challenge perceptions. And, I was bullied a lot growing up. Like the amount of bullying I put up with, I literally could have ended everything and got to that point. And at times I wanted to. And I was like, if I give up now, then I've lost everything. And for me, it's important. Yes, I have a learning disability. Yes, I need support. Yes, I need to speak up when I need it. And for me, people just don't understand what a learning disability is. They single you out. They call you names. They treat you differently, and it's disgusting. And I have it on social media sometimes. I get really unpleasant, messages sometimes, and people just don't get it. People don't understand. They just see a tweet and they think it's okay to hide behind a keyboard and say something really unpleasant. And I've had that. And it's words hurt. Like, you might not think your words have a reaction, but they do. Trust me. And I'm here to speak up for the 1.5 million people who live in England, in the UK, with a learning disability. And I'm not going to shut up until things change. I really wish the public could actually meet people with a learning disability and see how amazing we are. I wish employers would employ more people with a learning disability so they can see what they can do in the job. I wish more people would take on people for opportunities so they can shine and see what they can do. But it's this old thing of, oh no, we can't have them because we don't know what they can do. It's the unknown. It's ignorance, and it needs to change. Society needs to change. We are no longer living in the age of institutions and long-stay hospitals. We are now in 2021, where we are living in a world that's meant to be inclusive, but we are still not including people properly, and that needs to change. And society's attitudes need to change now, and we can then start changing perception.
That's incredible. It makes me. Why am I even hosting this? You should be hosting this. That was absolutely incredible, and you're absolutely right. It's a societal issue. It's a media issue. It's the lack. It is very much the lack of education. I mean, for instance, take the sign for disability. The logo is a wheelchair user,
yeah.
And of course, without proper education, proper signage, things aren't going to change. People are still going to rely on his old dark attitudes. And to hear you speak with such passion there, I think you've nailed it succinctly what should happen. I mean, everyone should just basically listen to you speak. That bit should be sent off as a little clip and just sent off everywhere to every media and politicians outlet in the country. It's incredible. But bringing it back, if you don't mind, to COVID, because COVID literally is affecting all of us. And as we know, communication is important, which you very much touched upon there. How have you found the messaging and the language used by the government in this pandemic? I mean, has it been a friendly language? Has it been accessible to people with a learning disability? Because from what I've seen, it's just been really, really, really heavy dialogue and graphs. How's it been for you to listen to those briefings?
That's a really good question. So, last year, when lockdown first happened, I was sent home from work, and then obviously the world went into lockdown. And I watched the first few briefings and there is no accessible information whatsoever. I will say now, the government were very, very, very slow in releasing accessible information. I would watch the Downing Street briefings every day, and I'd literally be on social media going, "You are talking jargon. This briefing is jargon. You are using hard words. You're using hard terms." The slides that they present, they were really inaccessible. They still are. All the briefings are still inaccessible. And there was a word the other day in one of the briefings that I think Chris Whitty used, and Boris couldn't even say that word. And it's just like he kept trying. And I was like, if you can do that, then you can use easier words and you can be accessible if you're going to try and do that.
No, exactly.
And, it makes me angry that why didn't the government put out easy read, accessible information at the beginning of the lockdown? They didn't. They relied on organisations such as MenCap and other organisations to create easy read publications and stuff on their websites and their social media. Now, we did that at MenCap. I actually worked on all the accessible, easy read information about COVID. I was in a role from June last year up until January this year, working on all of that with our comms team. I spent hours putting all the coronavirus guidance into easy read. I spent hours updating them when they all changed. I spent hours updating all the rules when they changed. I would literally have to grab our comms team, our information team, people with a learning disability. Every time the rules changed, we literally had to get on it really quickly. And poor people, not poor people, but it was like, no wonder we were all confused. I didn't know where I was coming or going most of the time. Yeah. And I was just like, if I can't understand the rules, and if we can't put this into easy read, then there's something wrong. And
absolutely. Forgive me if it interrupt you, Ciara. Forgive me, absolutely. But my daughter Emily is a wheelchair user, but she also has a hidden disability. And what I'm finding is that people with hidden disabilities, because they're not getting their information there, and that they're unaware, say, for instance, that MenCap are brilliantly putting this together, they're having to go for second-hand information from other people, and that information is not always correct. So that's creating misinformation for people with learning disabilities and hidden disabilities. So the government and organisations should absolutely be on this, because everyone is part of the same apparent global planet. Everyone's all in, so the information should be absolutely accessible for everyone. It should be made in all ways, because everyone's communicating differently. So your point is absolutely correct. Why should it have to come down to you, the individual, and the charity to word this, when the state should be leading from the top?
Definitely. I even got invited to speak at an all-party parliamentary group meeting on learning disability about accessible information during the pandemic. And I said, the government have not done this. They're being very slow to do it. We're having to do it in our organisation. Now, I think the government should have done it first doors in, first early days into it. They should have released all this information in a really accessible way. They didn't. And they should have done it. And it would have really helped everybody, not just people with a learning disability. It would have helped everybody. I was speaking to people who didn't even have a learning disability. They didn't even understand the guidance of coronavirus. They didn't understand the rules. Now, if they can't understand it, I was like, well, try having a learning disability. It's even harder for us.
That's it. See it from your point of view. See it through someone else's eyes. That's the key thing, isn't it, with a learning disability? But I mean, here at Intent Health, I mean, engagement and inclusion is our mission. This is the sort of thing we're looking to change. This is what our drive is, to make everything accessible and promote accessibility, diversity, and inclusion. So we should expect Downing Street and the scientific community to be engaging more with charities such as MenCap and businesses to help get the message across. How would you encourage the government and the scientific community to engage more? What would you say?
I would say, come and talk to us, come and meet us. come and share information with us. We are here. I even wrote to the government myself and said, come and talk with me and I can show you how to do it. And they haven't even tried. And that just shows me they don't want to. And it's just.
I know, it's beyond frustrating. It's beyond frustrating, isn't it? It's beyond frustrating. But I mean, obviously, in some ways, you see the government have got an enormous amount of responsibility and everything they have to do. So we have to give them, carte blanche for that because they're in the middle of this pandemic. But there is the other side of it, which is they have to consider everyone because they are the government of a country. So they have to consider everyone in that respect. But if I can just change tack quickly, even talking about learning disabilities, I mean, it brings us obviously onto vaccines and things. I mean, people are at a greater risk of COVID, as we know. The statistics literally speak for themselves. As I said, I'm a father to a child with a physical and a learning disability, and I'm worried. And even before the pandemic, people with a learning disability sadly died on average much earlier than those without. To us, it's unacceptable. That a group of people already facing barriers to healthcare are being forgotten. So why are we not being pushed up the vaccine list, do you think? Do you think it's about misinformation again or stereotypes?
Yes, definitely. I personally think it is awful that we are not in a priority group. We were originally in priority group 6. Then someone obviously decided, or people decided, that actually we're not in group 6 anymore, and now we're in with the rest of the nation. And we need support, we need priority. We face barriers. During the pandemic, some people have had their social care support cut, and it's disgusting. And men are 3.5 times more likely to die, women 4, and that's personally shocking to me. And why can't we be vaccinated? Why are we different? Why can't we be in a priority group? People with profound and multiple learning disabilities are in a priority group. Why are we being treated differently just because we have a learning disability? And it's disgusting. And this is why I've been campaigning through MenCap this week in the media to say, actually, no, this is wrong. We need to be given priority like anybody else. We are as important as anybody else.
I think you're right. I think it's a lack of engagement, isn't it, from say the political to the communities, and I think they need to be brought together. But I think what will happen now is obviously on the back of all this media shoutage about vaccination for learning disabled people. I think there's going to be a sea change, absolutely, because I think with everything they've had to do, they've been caught out, and they want to try and remedy this, which is a great thing to do. But it would have been nice if it done from the start. But now I think, thanks to the brilliant campaign that's going on, that the work you've done this week, which has just been absolutely incredible, I think that sea change will kick in and we'll start to see the vaccination program alter for learning disabled people. I mean, the government has given action to protect disabled people in the adult social care winter plan. And there is a thought that there should be a specific COVID task force to be put in place to find and protect people with learning disabilities. I mean, this can involve doctors, nurses, the communities, fantastic individuals like yourselves and the families. So I'm just wondering, do you think a special COVID task force could be achieved and set up? Could it be achieved? Is that something they could do to address this problem of vaccination?
I think we're seen as not important, and we're seen like, why do we need it? Why, people with learning disabilities, they can exist, it's fine. They can carry on life as normal and they can be vaccinated later. I think it's ignorance. I think it's like, why did you say we were in priority group 6 and then suddenly we're not in priority group 6? It just doesn't make sense. And, poor Jo Wiley, her sister is currently poorly in hospital fighting COVID because they didn't get the vaccine into her care home. Now, had they got the vaccine into her care home, they could have prevented this. And now, because she hasn't had the vaccine, she's in hospital. And it's again like we're not cared about, we're not important, we're treated differently. Whereas people with more profound and multiple learning disabilities, it's great that they're in priority group, but we should have been in that same and been vaccinated at the same time. And it's
No, I absolutely agree. Forgive me for interrupting you again, Ciara. I absolutely agree that you're correct on that. I was just wondering if what the situation, because it, like we said, it's down to lack of communication, isn't it?
Yeah.
And I'm just wondering if those who are handing out the vaccines, the ones in charge of the vaccination program, just see disability as a physical thing rather than a hidden thing, based on these old tropes and stereotypes. So I think the biggest issue here is there's been a sad communication breakdown. So there needs to be a more communicative structure around everything, you know, to bring everyone on board, to highlight to these individuals that disability is not just a wheelchair or a cochlear implant or a visual impairment. It's actually hidden. I think personally that could be the reason for the vaccination hiatus. So I think a task force specifically, I mean, the task force would be great. If you were leading the task force, it would be fantastic. I would love to see you. In fact, I'll probably go away now and champion that on Twitter, Ciara for task force, because I think with your wonderful way you word things, that the intelligence you exude and just everything you give, your passion, I think not only are you a fantastic spokesperson for people with learning disabilities, hidden disabilities, but I think you would make a very good politician at the end. Do you see what I mean? I think you really, really would. I really do.
If I could be on task force, that would be great. And I've even been in touch with my GP surgery this week, because it turned out that it wasn't on my record that I had a learning disability.
It wasn't on your record?
Yeah, it wasn't on my records that I had a learning disability.
How old are you now? Forgive me for asking.
41.
41, and it's not on your record. See, that's another communication issue, communication breakdown, isn't it? Sorry, please continue. Sorry.
It said that I had a learning difficulty, not a learning disability. So that's now changed. And so now it's on my record, which is brilliant. I'm also going to get a health check, because now that it says I have a learning disability on my records, I can finally have a health check, which I have been asking for 4 years now. I can finally have that. And, I shouldn't have to battle and continually speak up for my rights when I know what I'm entitled to.
Yeah.
And I don't get it. Why should I have to keep battling just to get something? I don't know what happened. Yeah. I don't know what the breakdown was in my records. I don't know where they got that from. But it's all now fixed. It's sorted. And, at some point, hopefully I will get the jab at some point, and that will be great, and I'll be protected. But it hasn't happened fast enough. I'm hearing some people with a learning disability are being contacted by their GP about the jab, and that's great. And I've heard that today from some people online that I follow, and that's great for them. But it hasn't happened fast enough.
That's the thing, and sorry to interrupt you again, but I think we can agree that this is a communication and inclusion issue, isn't it? And there's no one shouting out that these companies need to reach out to someone to access information and inclusion and a good, accessible way, and it's just not happening. But obviously, you're still working, aren't you? The way we work has all been affected by events. I mean, there is an Equality Law and Reasonable Adjustment Act for all disabilities, physical and hidden. But now we're home working. So can I just ask you, just to change the subject ever so slightly, have you needed any workplace adjustments from home? And have you been supported at home with a learning disability?
Yes. So I now have obviously a laptop, and I have a printer, I have a chair, I have a keyboard, I have a mouse. I've been given everything by our IT department. It's brilliant. So I can do my job to the best of my ability. My manager also put in reasonable adjustments so that I can work more flexibly. I can either start earlier and finish earlier, or I can start later and finish later. I have like a catch up with my manager first thing in the morning. I can then get on with what I need to do, and then I meet with him again in the afternoon, or if not him, another person in my team. And they've been so brilliant, and they've been so supportive, and they have told me, if I need a break, I can take a break. If I need to go out and get something, that's fine. Or if I need to have time out, that is fine. It is also okay not to be okay. I can have days where I'm not feeling happy, or, if I'm not feeling great, I can go, okay, actually, I just need, half an hour out, or I need a half a day out, or whatever. Like, they've been amazing. Um, I am just so grateful to actually have a job right now. One of my friends works in a restaurant slash bar, and she at the moment is not being able to work, and she's had to move back in with her parents. And here I am living in a lovely flat that's been bought for me. I'm working, I'm being paid, and I've had reasonable adjustments given to me so I can do my job to the best of my ability now. And that's brilliant. And MenCap have really thought about, actually, how do I do my job from home? So as long as I'm on email and I'm sending things across to people and I'm in meetings, that's fine with them. And like next week, I've got a week off next week, so I'm really looking forward to an annual leave week, even though I'm only going to be at home. Like, it'll be so nice.
Yeah, where else would we all be at the minute apart from at home? Yeah, it's debating whether we go on holiday to the kitchen or the bathroom, isn't it? But that's incredible. It just makes you wonder how many other companies are aware of an Equality Act or aware of reasonable adjustment. Once again, a communication issue, isn't it? But that's fantastic. You've been supported, and just the pride in your face when you speak of your work is just so infectious. This is why you're just such an amazing ambassador and campaigner for people with learning disabilities. I mean, I think there are signs that those living with a hidden disability are slowly achieving some sort of equality alongside those with a physical disability. I mean, there are sunflower lanyards, like you said, that there's reasonable adjustment if you work at home. There's widening of the blue badge scheme. Do you think, the pair of us, me and you, me as a parent and you as just an exceptional person, do you think the only way is up now for us as a community, hidden and physical disabilities, but mainly hidden? Do you think the only way is up? Things can only get better. Excuse me, D-Ream, that's your song. But yeah, do you think they can?
I think they can, but right now it feels like we are unheard. Right now, during the pandemic, I keep saying this, and I will say it till the cows come home. At the moment, in a pandemic, people with a learning disability have been ignored. We have not been heard during the pandemic. We have been forgotten during the pandemic. All my friends, all the close friends that I've got have a learning disability. Some of them live in supported living. Some of them live with their parents. Some live in homes. Now, I haven't seen them for nearly a year, yet I see them virtually, and that's lovely. And at least I get to talk to them. But they have been forgotten. They haven't been heard. They haven't been seen. And, before the pandemic hit, I was the most social person on earth. I would go to everything and anything. And I haven't had that for nearly a year now. And I've had to do everything virtually. I've had to keep raising my voice to be heard over the last year. I've had to work harder to be heard over the last year. And I've had to go, okay, I can't go into the office. I have to work from home. Okay. But I have to have support. Like my job coach, when I was doing my last role, doing the coronavirus accessible stuff, I had a great job coach, but then he was then asked to go and support 4 or 5 other people as well as me in my job. And, it was hard because we'd have to go, right, what time are you free? Oh, actually, you're seeing that other person, but when are you going to support me? And it became so hard last year. And I don't know how we did it. I think he's Superman. And in the end, he just flaked out. He was so tired, and he was spending 7 hours a day supporting people on Teams meetings.
7 hours a day?
Yeah. And I don't know how he did it, but by the end, I said to him, this is ridiculous. You're getting no support, and nobody else in his team was supporting him. And at times, he would just go, can we have a break? And I'd be like, go and have a break.
Let's just have a break. I think a break is absolutely needed. But judging I think personally that with this next generation that's coming up with you and my daughter's generation, I think things are absolutely going to change, because I think what with the news of people with learning disabilities and the vaccine and the tragedy of 2 out of every 3 deaths of people having a disability, I think this is finally going to be the pick that chips the rock, that turns it into rubble, which will get people finally aware. I mean, the 3 things are investigation, communication, and engagement. That's the 3 things I think need to happen. I think they're slowly happening now. That's what's going to happen, I think. And like, I keep coming back to you because I just think you're incredible. But with you and my daughter's generation leading this charge now, things can only change for the learning disability community for the better. Like I said, investigation, communication, and engagement. Communication is the key thing.
I agree, but also under the Equality Act,
yes,
it states we have to be treated equally.
Yes.
Now, right now, I don't think that's happening, and people need to remember the Equality Act, because right now I don't think people are actually realising the Equality Act exists.
Well, time's up. Thank you, Ciara, for your wonderful input. It's a pleasure to know you, and I can see you're going to make great strides and just be the voice of people with a learning and hidden disability. This is brilliant. But I will leave you with this. We must remember that those with a hidden disability can bring high levels of creativity, entrepreneurship, and diligence to the workplace. With the correct measures in place, staff training, signage, such as not all disabilities are visible, employers being proactive and patient, celebrate awareness days, etc., things like that. Communication, investigation, and engagement. People can continue to play a huge part in a now changing world. We must also remember, as employers, as humans, and as a country, that COVID changes our perspectives and expectations, that we drive to include everyone. Hidden disability may not be obvious, but with open minds and with the right help from the right people and organisations, understanding is within reach. And I'll just say it one more time so you're all bored of it. Communication, investigation, and engagement. Ciara, thank you.
Thank you for having me.
Thank you for listening to the Intent Health podcast. If you like what you heard, please share with your friends, colleagues, and communities. For more information, please visit our website at www.intenthealth.co.uk.